Hi, good morning, everybody. It was so nice to see so many people come from Hawaii, Los Angeles. Thomas, haven't seen you for a long time. That was nice to see you from Los Angeles, and also from all over the world, Vancouver, Honolulu, and Philippines and South Asian countries. So that was so nice to see so many people of you. And today, actually, we have a pretty very good, important sort of wrapped up what have been really happening in the diabetic world or pre-diabetic world. So this is going to be a very interesting webinar to help you to better understand what is coming around in diabetes. So I thought that perhaps we'll give you a good summary, and so that way you can able to start understanding, wow, really I'm in the right track to better protect myself doing the things that I need to do to really not to get diabetic complication. Or if I'm just a pre-diabetic, I better start changing my lifestyle so I won't fall into the trap of become a diabetes. And that's why this lecture for. It's very interesting. I actually, a lot of the actually diabetic educator actually approached me and said, Andrew, you're doing really good stuff. The reason why is that most of the hospital or other places that so far we see, they talk a lot about mainly on the dieting, but not give you the whole picture of diabetic management. And so they said it's really important. You got to provide and continue the diabetic management so people are aware, alert, and so forth. So that way they will be really say, wow, okay, I better be very, very careful. And then I will not being, too sort of a little about it. So that will be really important. So that's why I think this lecture will be very helpful for everybody. 各位朋友，我係 Angela 嘅 Lowsutea President 好嗱，今日咧其實好特別嘅喎，點解咧？因為你問，喂，點解你即係咪真係咁多人又要再聽diabetes 嘅問題啊咁啊？咁其實咧，我係亦都有好多即係美國嘅朋友啦，同埋喺香港嘅學員啦，同埋咁佢哋話其實好多時咧，佢哋未必即係知道點去。點去 understand 嗰個diabetes 嘅，咁所以變咗嚟講咧，就佢話多數所聽到咧，只係食喺個食嘢方面嘅管理，咁所以變咗嚟講咧，就唔係話咁多人咧，亦都可以知道，哇，其實整體係點樣咧？咁佢哋話好有意思咧，就係、哇，如果我係睇到整體係點樣嘅，咪更加好嚇。咁佢 basically 咧。即係好多做醫療管理嘅人咧，都話俾你聽，哇！你做嘢好喎，因為能夠幫助好多人係更加了解。當你更加了解，你就開始預防嘅工作，所以呢個係一個好好嘅東西。喺 Facebook 有好多人係 live 聽緊嘅，你可以俾個 likes 我喺嗰度 Facebook 個撳個 likes， 我有一班人喺度嘅，咁或者俾個 likes 我喺嗰度撳個掣 likes， 唔該晒 ，OK。So we're going to start our webinar. I think it's be really good. I thank you very much for the likes, and it's really good. I saw some people are pushing the like button in the Facebook, so that would be nice to get some of those. So I'm going to start sharing my screen and go from there. Thank you very much. So today we will talk about facts you should know about type 2 diabetes. But actually, this fact is not only for type 2, but also for the pre-diabetic, because all these are related. If you don't do anything in 3 years, you'll be part of the statistic, and you really don't want to do that. 各位朋友，其實咧呢個咧要記住啊，因為依家想知道咧二型糖尿病嘅實際情況啦。咁啲人話我都未嚟二型喎，咁點解要聽呢樣嘢啊？其實唔係，因為好多前期患病者咧，原來80% 都唔知道係前期患病嘅。咁如果佢咩都唔做咧 ，guess what？3年之後佢變咗糖尿病病者喎，哇！咁好弊，即係話如果你有機會係更加早啲知道，咪快啲真係要早啲了解咗之後咧，然後就可能夠俾多啲人去即係了解，俾多人去知道點去預防，咁啊更加好係咪？咁今日嘅講座就係咁嘅 ，OK？ 咁今日講座有乜嘢啊？裏邊第一，咁咩叫去糖茶咧？點解去糖茶 work 咧？第二咧就咩叫二型糖尿病咧？ 咁其實二型糖尿病咧係點開始咧，同埋點去能夠唔會變咗前期唔會變咗二型糖尿病咧？咁同埋裏邊咧有幾多係幾普及化，同埋有幾多人喺度糖尿咧？哇！其實呢個好大個 number 嚟嘅喎。咁同埋咧你係如果你係二型糖尿有咩健康嘅問題出現咧，同埋你個症狀係點咧，同埋你點樣管理咧？咁最後啦，我哋係繼續點樣能夠用咗去糖茶幫助你係管理呢樣嘢嘅。So today our agenda is first we will talk a little bit about what is Lowsutea, and then from there you also understand what is type 2 diabetes. Because at the end of the day, you really got to understand what is type 2 diabetes, why that happened, and then what is prevalent. In other words, what is happening in the type 2? Is it a lot of people? Is it really common? And then what is the healthy people versus unhealthy people? In other words, the one who already pre-diabetic diabetes versus non-diabetes. What they look like. Plus what are risks and symptoms, plus the complication they will be facing. And I found out a lot of people actually, even they're pre-diabetic, they already start getting some of the symptoms start coming in already. So this is the kind of thing you just gotta start watching. So at the end of the day, how you manage this, how you get this change to make sure that you will not continue to be fall into this complication. And last but not least, how Lowsutea can help you manage your blood sugar levels. That will be something that was so good to talk about. First of all, let's talk a little bit what is Lowsutea. Okay, now Lowsutea is an award-winning natural, all 100% natural sugar cleansing tea, which is combined with two things, which is guava leaves and bitter melon, and both actually benefit all people who have high cholesterol, blood pressure, and then eventually they move into the pre-diabetic stage, which is we can basically, after drinking Lowsutea, they might not even get into pre-diabetic stage because their blood sugar continue to be good level, not moving them to be with the A1C more than 5.7 to 6.4. And so net result, what we're trying to encourage people now are drink Lowsutea, even though they're not pre-diabetic yet. They have just high cholesterol, LDL, and also start other, just that high cholesterol and also high blood pressure. They already should drink Lowsutea. And more people doing that, they found that, wow, actually brought down my cholesterol, brought down my blood pressure. And at the end of the day, they never even go into pre-diabetic stage. That would be really good. So we are proud of ourselves, actually got the best natural sugar cleansing award in 2002. So 各位糖友，好多人都問，喂，你係咩個去糖茶？咁其實去糖茶第一係一個攞咗最佳天然糖尿茶去糖茶嘅大獎，係2021年攞到嘅。咁其實裏邊得兩樣嘢，有番石榴葉啦，有呢個苦瓜啦，咁然後幫助啲前期慢病人啦，同埋糖尿病病者降低血糖啦、膽固醇啦、血壓嘅排毒，三高都做到嘅。嗱，其實呢個好重要咧。其實原來依家越整越多人咧就話，哇，我好好喎，因為點解咧？我飲咗去糖茶，我都唔係前期患病，但我只有LDL 嘅膽固醇高同埋血壓高，我都飲咗，哇！咁佢覺得現在已經係 improve 咗個身體，咁近年去去呢個前期患病都冇，咁啊更加好。所以依家其實咧，我哋都希望多啲朋友咧係已經有高膽固醇嘅時候咧，咁然後咧同埋血壓咧有飲。咁我依家解釋下點解咧，咁你會睇到嘅。嗱，呢個 stage 咧就我都第一就要講講咧，會變呢個係一個 important slide， 咁你可以影張相都得嘅。So everybody should understand it's so important, really, at the end of the day. You really this is a slide that I kind of improved a bit from previous slides to make it a little better, easier to understand. Very important. Actually, everybody go through four stages to become a diabetes. And that's why I was saying that really the first stage is when your LDL goes up, and then they damage the B cell, which is the cells that take the sugar into the cells, right? The insulin come out with a B cell, and it's like a key and took the sugar into the cells. But if your B cells are damaged, the sugar are not going to the cells, so the sugar are continue to increase in the blood vessels. And then the LDL cholesterol and the blood get together, they become very thick. Now, that is the problem comes in because that move you to stage 2. When the blood become thick, then you have forming plaques everywhere, which and that will affect your entire body, including your brain, your muscles, everywhere, your heart. So you might say, hey, my blood pressure go up a little bit, but that's okay. But on the other hand, don't forget, this is plugging entire body. So you will get problem, maybe not seeing anything happening for the first 2, 3, 4, 5 years. But after 5, 6, 7 years, the problem is coming because it continue to plug your whole body. So the second stage, basically, your blood pressure just go up. But this is the real problem from diabetes. They plug everywhere in my body and continue to plug. If you're 10 years, 15 years plugging everywhere, your problem is going to come eventually. And that's the sad part because your healthcare costs will go up at the end, 10, 15 year stage. Wow, that will be very expensive. Okay. So the third stage, if you don't do anything, for example, your cholesterol goes up, your blood pressure starts going up, you didn't do anything. That result, you didn't do any lifestyle changing, no dieting, your blood sugar eventually goes up. Now, there is a thing that all doctor will measure is called the A1C, HbA1c. Now, the HbA1c, what they measure is very interesting. All they do is measure the percentage of sugar attached to this hemoglobin. Everybody have hemoglobin. And this is giving you a 3 months average of the sugar in percentage. Like if you are under 5.7, you're a healthy person. If you are over 5.7 to 6.4, you have become a pre-diabetic. And then if you're over 6.4, 6.5 and up, all the way above, then you are actual diabetes. Now, that is really how all doctors in the whole world to determine are you a diabetic or not diabetic. Now, the interesting thing is when you are pre-diabetic, you have no medication. No doctor give you medicine. Only thing is they will tell you, hey, you know what, you are pre-diabetic now. You got to best start doing some adjustment of your diet, not to eat much sweet. But, majority of people will not understand that. So they say, hey, okay, I don't eat sweet now. I cut down my cake and so forth. But they still eat rice, they eat a lot of other starchy stuff. Really, at the end of the day, and they eat white bread. Everything that is really not good for them, they're still eating. So net result, in 3 years, if they don't really concentrate on how to fix the lifestyle, the 4th stage will come in. They become a diabetes. When they're over 6.4, if they're 6.5, you know what? They became a diabetic. Now, once you become a diabetic, you know what? You can't go back. And that is the problem because once you become determined diabetes, if you are like moving up in half a year, doctors say, hey, okay, you now become a diabetic. They will actually not going to change your record and say you are not, even though you drop back down to 6.4, they basically start locking the documents already. So your insurance go up, everything go up. Wow, that would not be good. On top of that, because you did not form a habit, you continue your same lifestyle. Net result, many people will just seeing that blood sugar continue to go up and up all the way to 7, 8, 9, 10, A1C. Okay. So this is why I'm trying to do all these education to help you prevent yourself moving beyond 6.4. 嗱，各位朋友，記住，所有糖尿患病者咧都 go through 4個 stage 嘅糖尿患病嘅4個 stage。邊4個啊？第一個 stage 咧就係個 LDL 上嚟啦。咁 LDL 上嚟咧就 damage 咗喺胰島素出嚟嗰個叫 B cell 啦 ，boy 啊 B cell，B cell 就帶啲糖咧入翻去個細胞裏邊嘅。咁當啲糖嘅呢個 B cell damage 咗就唔帶糖入去咧，咁你血糖咧越整就越高咯喎。咁越整越高嘅時候咧，膽固醇加糖加埋咧就會好結，啲血開始結啦。咁啊 stage 2嚟啦。當血好結嘅時候咧，就令到你血壓上升，因為咧呢啲咁嘅結嘅血糖咧。就會開始 plug 你嗰啲血塊喺個血管裏邊，一路係咁全身係咁 plug。嗱，糖尿病咧係最大問題呢樣嘢啦，因為咧以後咧一路落去咧，你叉落去嘅時候咧，就係因為全身嘅血管都係咁塞， 哇，咁你就塞你心臟啊、腦啊，乜都係咁塞噶咯。所以呢個係一個長遠嘅問題，你一定係控制唔會俾佢壞嘅。咁當然咧，如果你咩都唔做嘅時候，你就 move 咗去第3個 stage 咯。嗱，血糖繼續上升，咁醫生咧全部都 measure 一樣嘢叫 A1C HbA， 你有一個叫紅血球個 hemoglobin。咁呢個紅血球嘅 protein 咧，紅化血糖咧，呢個糖化血紅咧就會係有幾多個 percent 百分比嘅糖係黐咗呢個紅血球裏邊嘅。咁呢個咧，如果你有5.7以下咧，咁你當然係 low person 啦。但係如果你5.7至6.4咧，原來話弊家伙啦，你就已經係咗一個係前期患病啦。如果繼續唔理因為嗰陣時咧你冇藥食嘅喎，醫生只話咩？你前期患病啦，你小心啲話，咪食甜嘢啊！可惜呢句説話講之後咧，你都係話我冇食甜嘢，但係你繼續食飯。你又唔做 exercise， 又繼續食白麵包，咁你糖咧繼續高，你生活習慣冇改變，咁多數嘅人咧喺3年裏邊咧就會轉咗去糖尿病，因為你個 A1C 咧係過咗6.4啦，去咗6.5啦，咁啊第4個 stage 出現咗啦。咁以後咧，如果你再唔改變咧，哇個 A1C 一路上去就好弊咯。OK， 所以記住6.4以下你就 OK 嘅，咁你繼續係要 drive yourself 去。under 5.7以下就唔係話係 stay 6.4 ，OK？ So what Lowsutea can help you? Basically, Lowsutea can help you lower your blood sugar level to prevent your delay or onset of type 2 diabetes, okay? And also because of the fact that you continue lower blood sugar, so you are actually decrease the chances you have any diabetic complication. Even you are diabetic now. A lot of my customer basically had A1C more than 10 and up, and they eventually drop it down to what? 5.7. I was so amazed. And they even don't go 5.7, 5.8. It's okay, but they are able to drive it down. But they actually do work. They control the diet, they exercise, and they have also controlled their weight. But one more important, like Fei Mao is telling us, he drank Lowsutea. Somehow, without Lowsutea, they could not bring it down. You have to have that booster to help you. So Lowsutea definitely help you better blood sugar levels. Secondly, Lowsutea help you another thing, lower your blood cholesterol, LDL. So if that go down, then it also don't get your blood to be thick. And then that result, you also will, get your less blood to be plugged. So it support you for better blood sugar, blood pressure. So blood pressure also go down. A lot of my users actually using Lowsutea also see their leg swelling went down. And that was really amazed that my leg is always swell. And I thought that after drinking Lowsutea was amazed. My leg swell went down. And they can also detox naturally to eliminate toxin from your body and improve health and also promote weight loss. A lot of people after drinking, their tummy also comes smaller. So isn't that wonderful? That's what Lowsutea can help you. So 各位去糖茶有咩幫手咧？第一，去糖茶咧幫你降低你血糖嘅水平。嗱，呢個點解咁重要咧？因為其實好多糖尿患病者、二型糖尿患者，如果你唔去控制血糖咧，一路係咁高上去喎。咁但係飲咗之後咧，佢因為咧係佢有2種嘢裏邊咧，遲啲再講啦。佢帶翻啲糖咧係入去，即係 increase 個 insulin 嘅敏感度，帶啲糖入去個血細胞裏邊。咁用咗啲糖啦，如果 extra 掉出嚟啦。咁仲有佢降低你膽固醇 LDL， 咁你血就唔夠結啦，亦都如果唔夠結咧，咁你血壓亦都降低啦，同埋仲有一樣嘢，你個腳腫啊都會降低啦。第三，仲有天然嘅排毒啦，咁你將啲毒素掉晒出嚟，喺尿嗰度掉出嚟，仲有改變咗你好多時咧，因為改變身體健康啦，仲有幫助你減肥啊。咁呢個係一個好好嘅東西，咁繼續諗咯。咁其實咧點解會咁 happen 咧？就係第一。你睇到去糖茶有2樣嘢啊，第一就係呢個叫 guava leaves 啦 ，guava leaves 咧就幫助啲糖咧係即係減持咗佢進入血管裏邊啦。 同埋有苦瓜啦，苦瓜咧就係將啲糖 increase 咗佢個胰島素嘅敏感度，就帶啲糖入翻細胞裏邊。咁佢用咗啦，咁但係有 excess 點樣咧？喺尿啊掉出嚟，掉糖出嚟，掉埋膽固醇出嚟，仲有鹽掉咗出嚟。咁鹽掉咗出嚟咧，血壓就會降低，同埋咧仲有幫你係排毒。哇！呢個真係好特別啊！ So how really Lowsutea works is very simple. One, Lowsutea has two ingredients. One is called guava leaves. What it does is it delays the absorption of the blood sugar into the vessels. And then on top of that, they have bitter melon, which is increase the insulin sensitivity. So they take the sugar back to the cells. But excess sugar, they will dump it out to the urine and also dump cholesterol out the urine and also dump salt out the urine. Now, after salt went out, then your blood pressure will come down. On top of that, a lot of people drank it. They also lower the swell of the leg. Plus, also because of the fact that the blood pressure went down and everything went down, they also detox it, throw all the waste outside. So that is really what Lowsutea does. And it's really wonderful. There are three things: blood sugar, cholesterol, blood pressure went down, plus the detox. So a lot of people, and also people drank that, they also seeing the weight went down. And our company have also a 5 program helping you to basically understand what is dieting, drinking Lowsutea, how to drink, how low carb diet, low fat, and so forth. And we'll teach you about exercise, 8 to 10,000 steps per day, and you control your BMI under 23. And then we have weekly webinar just like today. And then we have also blood tracking method to show you. We want to get your A1C from whatever amount, 10, 11, doesn't matter, come down to 5.7. That is our goal for you. 嗱，各位朋友，我哋 basic 咧有5個 program。第一個咧就係依家飲虛糖茶點飲啊，或者食嘢點食啊，點能夠用低碳水化合物食嘅東西啊，減低脂肪啊，每日點行咧有8000至1萬步啊，同埋咧仲有降低 BMI 有23個去到 BMI 23，同埋有聽到我醫生講就每個禮拜都有啦。咁同埋咧點樣度啲血糖咧，點樣 track 咧，同埋呢啲好重要嘅。Okay, so we have taught the basic understanding everything on why Lowsutea will help you. Now let's talk a little bit more. What is type 2 diabetes? Okay, actually a lot of people say, wow, is it really just sugar in the blood? Well, yes, in a sense it is. But the thing is, why did it work? Why did it work? Because of the fact that the body just doesn't come up with enough insulin to help you to take the blood sugar into the cells. And by the way, 95% of the diabetic patients are type 2 diabetes. Now, type 1 is when you're born with it and you don't have insulin. That's a different story. And we now focus all type 2 diabetic. And type 2 diabetic really actually is 2 primary things that will bring you into this stage. One is usually your body weight tremendous increase, you don't move, and a lot of the influence is also your dieting. So that is something that is really a typical type 2 diabetes. Basically give you that, your excess body weight, and you are not a person that you move a lot, you don't do a lot of activities, and you continue eating with all the carbs that you built in. And usually the sad part is type 2 diabetes are usually found in not only now younger adult, which is meaning we have friends that now is only 35 years old or 30 years old already developed type 2 diabetes. And so as time goes on, this has now become a much higher number of young people. The good old days, maybe 30 years ago, usually the people become type 2 diabetics is 60 years and out, but now younger folks are coming diabetes. So it's kind of a little bit kind of scary now. And so you got to really understand why this works. 嗱，二型糖尿病咧，其實咧就最重要咧就係你個身體做唔夠胰島素出嚟咧，帶翻啲糖入去嗰啲細胞裏邊。咁其實咧 二型糖尿病咧，95% 嘅糖尿病患者都係二型糖尿病嘅，同埋咧多數呢啲人咧係身體好重咧，即係好肥胖啦。第二咧，佢哋係多數係唔喐啦。咁但係點解會肥胖咁急弊啊？因為好多時咧就佢哋食材方面咧冇控制，成日係食好多不同嘅 carbs， 好多就碳水化合物，咁佢糖一定高㗎，係咪？咁同埋咧，仲有常見咧，就好多依家開始年青人開始常見啦。舊陣時咧，30幾年前咧係咩人多咧？60歲以上嘅人先有嘅，55歲啊，60歲。但係依家唔係喎，依家我見到30歲嘅人已經開始有啦，所以其實呢個係好大問題嘅。但係一型嘅糖尿病病者咧，係全部係都一開始佢即係生出嚟咧，佢做唔到胰島素，冇解照日日都打胰島素啦。咁呢個咧係即係一個多數係咁嘅症狀出嚟嘅。咁所以變咗嚟講咧，你一定要睇住，因為95%二型患病者都係自己因為係本身係 OK 㗎，但係如果你冇防禦到，咁你變咗二型啦。但係如果你防禦到，你唔會出現喎。OK， 所以其實可以嘅。咁其實現在嚟講喺世界上咧，so in today, you know, in prevalent type 2 diabetes, according to World Health Organization, there are 438 million people are globally at diabetes. But you know, there's an estimate of pre-diabetic as 1.5 billion people. You know that? With a B, billion. Wow. And because when you look at statistics, every basic country, 30% of the people either pre-diabetic, diabetes are very, very close. Some places like Kuwait and other places, they have 20% of the population are diabetes. Imagine that. So that can be a humongous health problem as you move on. Now, 95% of the diabetes are all basically type 2 diabetes, okay? So in the sense that when you look at further and say, wow, you mean the cause of death, 1.5 million people, 48% are basically age before 70. They die. Imagine that. So you want to be healthy. You want to be 70 is very young. So you don't want to get yourself into that boat, right? And then on top of that, there's about 460,000 people are dying of kidney disease. And this is kidney disease death was due to what? Diabetes, okay? On top of that, many of the people have blindness, stroke, heart disease, and they have to get the leg amputated, and also kidney disease. When I was a executive for Baxter, when I do CAPD, I developed launched a dialysis therapy, continuous ambulatory dialysis in whole Asia. At that time, 50% of the patients are basically diabetes. Now it's 75%, so the growth are humongous. So that result, and on top of that, 70% of all diabetic patients usually have some form of kidney disease. So if you don't control your kidney disease up to 30% failure, you know what? You have become, you have 30% kidney function, then you actually end up will be a dialysis. Wow, that would be terrible, right? So on top of that, increased dialysis mortality rate is right now is about 3%. So it's continuing creeping up, it's high. And 20% of the cardiovascular death are related to some kind of blood sugar level. So in other words, a lot of people are dying of heart attack. They basically, this person died of heart attack, but because they have diabetes or because they have some kind of high blood sugar causes the heart attack. So that result, you're gonna ask yourself, diabetes type 2 can be very, very costly and can be very detrimental for you. 嗱喺世衛裏邊咧，二型糖尿病其實好普遍，已經有404.38億嘅人咧係有糖尿病，915%呢啲咧全部係二型糖尿病嚟嘅。然後原來全世界咧有150萬人死亡咧，係都喺死亡裏邊咧48%咧都喺70歲以前喎，即係話好後生會死嘅咯。咁仲有咧46萬嘅人喺世界係因為腎病咧係會死咗喺糖尿病嘅引致嘅腎病嚟死嘅。咁同埋咧，如果糖尿病患病者好多時有盲啦、中風啦、心臟病啦、斬咗個腳啦， 同埋仲有腎病嘅問題啦。咁同埋2000年至2019年咧，嗰個死亡率糖尿病嘅死亡率係升咗3%嘅，仲有20%嘅心血管病嘅人咧係有增加咗死亡咧係20%，即係話咧，如果我有糖尿病，我冇理乜滯，咁如果死嘅時候咧，多數好多時咧就係因為心臟病啊、心血管塞晒啊，然後會死嘅。咁20%係好高喎，係咪？So let's talk a little bit about what is healthy person and what is the diabetic person. So you have an idea what it is, okay? And that would be really important. First of all, when you eat, okay, now you eat, and then your body will convert all your food into glucose and absorb in the bloodstream, right? Now that glucose will either go to your muscle cells or all the other cells, or go to store to the liver and store both this sugar into the liver, or you can use it in your daily activity, all the cells, the whole body. But if you don't do it, then this is going to go to your muscle, go to your your liver. That's a healthy person. But if you have type 2 diabetic, the problem is coming along because your pancreas come out with a lot of sugar. Pancreas come out with a lot of insulin, and it's supposed to help the sugar into the cells. So the insulin is supposed to take the sugar in the cell, but your insulin doesn't work because of the fact that it's not getting insulin resistance. They damage the B cell, remember? So it doesn't carry the sugar into the cell. So the sugar continue to build up in the blood vessel. And then also because of the insulin resistance, it doesn't convert the sugar into the muscle, or also it doesn't convert the sugar to store into the liver. So both things is not into the cells anymore. So your sugar are continue to build up. Now that is considered maybe very dangerous as we move on. Short term, maybe no issue, but long term, remember, we have the sugar and the cholesterol get together, become thick, so you start forming clots, plaques everywhere. So that is a real problem of type 2 diabetes. 嗱，健康嘅人咧，食咗嘢之後咧，當然啦，將啲糖咧就擺咗落去血管裏邊咧 ，convert 咗血管咧就用啲胰島素就將啲糖就可以帶翻入去個血管裏邊咧，然後咧就擺喺嗰啲肌肉啊，同埋呢個個肝裏邊係咪？咁但係當你係有糖尿病嘅時候咧，就算你啲糖轉入食咗吸收咗血管裏邊啦，但係因為個胰島素抗拒咧，咁佢其實咧就帶唔到啲糖咧入去個肌肉裏邊咧，或者細胞裏邊咧，亦都帶唔到糖咧去個肝裏邊。咁啲糖咧就越整越高，咁所以變咗嚟講咧，你呢個最大嘅問題就係，如果糖尿病最大問題就喺呢度喎。記住嗱，跟住糖尿病咧，當你一路上升嘅時候，有個問題啊，就係佢同埋啲膽固醇加埋晒啲血管好結啦，啲血好結啦，好結嘅時候就痛到係咁塞啦。咁呢個就問題出現㗎啦，所以變咗嚟講咧，你一定要降低個血管，仲要所有糖都要降低。Another thing, actually, besides your diet and the amount of eat, you for type 2 diabetic also have some kind of risk factor. Now, first of all, your risk factor is if you are pre-diabetic, if you don't do anything, you know what? You are going to convert in 3 years. You become a diabetes person. So that is something that you keep in mind. You don't change your lifestyle, you're pre-diabetic, you will get into become a diabetic person. Now, especially if you are high risk, especially overweight. If your BMI over 30, in other words, your BMI is 32, 3, 4, 5. So you will have a higher chance, because you are definitely call yourself obese, you definitely have a higher chance to become a diabetes. Also, an age factor. If you're over 45, you also have a higher chance to be diabetes. And so nowadays, I even see the age group as going younger and younger, because more and more people are not age 45, and they are young as 35. Matter of fact, I have a young patient who is aged 40. He has already have type 2 diabetes. So now he's drinking Lowsutea and lower blood sugar and start changing lifestyle. So it's very encouraging if they get it early. But imagine if they didn't do it at age 40, wow, it doesn't happen. I just continue the same lifestyle. Imagine if that is the case, what could happen to these people when they get down to 50 years old? They have all kind of problems coming in. So in other words, your diabetes become very serious. Also, if you have family health history, meaning that your brother, sister, your mom, your dad have diabetes, most likely you also have a higher chance of diabetes. Now, very strange. I actually, not very strange, I mean, very happen. Many of my patients, I said, why you buy so many bags of Lowsutea? He said, well, because I buy for my brother, I buy for my sister, I buy for my mom, I buy for my dad. Wow, that's 5 people. Herself and 4 more people in the family require to be a drinking Lowsutea. So you can see, really, if your family have diabetes, most likely your uncle, your auntie, they all have that because it's genetic, really generic influence. So that is something that you really gotta check. Now, also, if your lifestyle, wow, I don't move much. I like to sit there, watch TV. I'm a potato couch person. Wow, then you have a really problem because after you eat, your fat sugar all stored inside blood. It doesn't utilize it. You will continue to add weight. So that result, because you always sit down so much, you know what? You are down the road will become very, very obese. Your blood sugar can go up. If you lower 10% your weight, you know what? You can lower 1% of the A1C. Imagine that. So make sure you take yourself, lower the weight, move around, take 150 minutes per week to do exercise. If not, you might have that issue, okay? Gestation diabetic is very real because a lot of people who are doing pregnancy, they become diabetes, they got well after pregnancy, but 5 years later, you know what? They become diabetes. So you really got to change this and make sure that you have to watch if you have a gestation diabetes before, okay? 嗱，其實二型糖尿病咧個危險因素咧有幾種嘅。第一，如果你已經係前期患病者咧，咁你就需要咧係真係要好注重去改變生活習慣。如果唔係咧，好快脆3年後咧 ，guess what？ 你就轉咗去糖尿病咯。第二，如果你係肥胖嘅，亦都要好小心啦，因為肥胖咧就係多數咧你一定會糖係好高，因為你肥胖啊嘛。咁如果 BMI 高或者30嘅話，咁你真係要注意啦，因為咧呢個係一個 marker。30咧，你唔落翻嚟咧，你個 chance 嘅糖尿病係好高嘅。仲有45歲嘅人士，因為依家咧越整越年輕化。如果你係45歲，咁你亦都要即係 watch 呢樣嘢咯。仲有呢個更加特別啊，因為咧係原來咧糖尿2型病咧喺家族嘅歷史裏邊咧係好重要嘅。因為我問我啲朋友，即係買我哋茶嗰啲咧，我話點解你買咁多包5包喎？佢話係啊，因為我買包俾我阿媽啦，俾我個妹啦，俾我細佬啦，俾我即係自己啦，同埋我其他 uncle 啦。哇，點解咁多嘅？原來咧佢家族咧有5個人裏邊已經係糖尿病，同埋佢 auntie uncle 咧都係糖尿病，所以買好多包嘅。個原因就係因為原來佢哋全家都係。咁其實唔淨止係呢個咧，好多睇到咧就係如果我哥哥有，我妹有，好多時佢自己都有，或者佢媽有，佢有，咁呢個係好常見㗎啦。咁同埋仲有一樣咧，如果你坐喺度唔喐乜滯咧，個 chance 亦都係 increase 你個 risk 嘅，因為你多數係肥胖啦，因為你唔喐動啦，咁你多數咧個即係個二型嘅糖尿病係高嘅。咁仲有一樣，如果你懷孕嘅時候有個糖尿病之後啦，你都有機會咧2、3年後你個好翻，但2、3年亦都要注重咧，你有機會咧變咗糖尿病者嘅。And the sign and symptom usually start off for diabetes actually increased thirst. I drink a lot of water. And my skin is dry. Some people start a blurred vision, okay? And they all feel tired all the time. and then they also have tingling feeling of the hand. And then some of them even can explain why there's a bunch of weight loss, and they're also very hungry very fast, eat a lot more, and they feel numbness, and then also frequent urination. They keep going to urine all the time, and then also later on they start seeing that, hey, how come the sore or the blister doesn't heal well, and it heals very slowly? All these are due to poor circulation come from the plug. Remember, the thing is this. You gotta watch several common sign is dry skin, because many people, because the circulation become poor, the skin become dry, they start flicking, and then they start actually you can see your skin become very dry, and on top of that, also numbness, tingling hand and feet, because they start getting nerve damage, so they will feel that. So even pre-diabetic have some of this issue already. So that's why when you have that, you really gotta go see a doctor to find out exactly where am I. Am I already as type 2 diabetes, or am I a pre-diabetic? You need to start finding out and getting your baseline to understand. Imagine 80% of the people find out themselves are pre-diabetic are in accident. In other words, they go to health check, I'm diabetic or pre-diabetic, and those are 80%. So there's a lot of people who thought, oh, I'm okay, but suddenly they start finding out I'm a pre-diabetic or diabetic already. So this is something that you really got to take effort to check. OK， 各位朋友，喺糖尿病嘅症狀裏面咧，前期患病都有呢啲嘢嘅。好似 for example 嗱，首先糖尿病多數好多人咧就話成日要飲水啊，好頸渴啦，咁就話咧皮膚好乾啊，或者眼咧開始蒙啦，咁或者好疲攰啊，成日都好眼瞓啊，咁樣冇晒精力啊咁，咁啊手腳有少少麻痹啦，咁同埋咧仲有咧覺得係即係個食嘢食唔飽嘅，成日要食好多嘢嘅，咁同埋咧有少喺個身體有啲手腳咧有冧啊。感覺唔到啊，同埋成日去小便啊，同埋咧仲要咧有陣時啲傷口唔會好嘅，腳嘅或者手啊咁，多數腳嘅係唔會好。咁同埋仲有咧有陣時忽然間減磅減好多喎。咁呢個其實依家都常見到嘅前期糖尿患病者嘅開始就係呢樣嘢。但係前期患病都有喎，因為咧好多時咧就皮膚乾燥。或者咧係會有啲手腳開始麻痹，或者啲 tingling feeling 啊咁，呢個咧亦都係好多前期患病嘅人有感覺。又係 skin 方面係乾咧，係會好多時都有嘅。咁你就要開始 alert 呢樣嘢咧，就去揾醫生睇下你依家係前期患病啊，又係糖尿患病者啦。But if you don't do anything, the risks are high, because the risk will come down is like you have a chance of stroke, conscious memory, you're losing your short-term memory, by the way, and then you have a cataract, glaucoma, your pancreas malfunction, you need insulin injection. As 40 to 60% of diabetes patients will have heart disease. That's when you got a heart attack. I have a patient, actually, he has 3 bypass, and he's a diabetic. Doctor tell him, wow, your blood sugar continue to be high, so you continue to have diabetes issue, continue to have heart issue. So the heart issue is caused by the diabetes. It's not, it doesn't come by itself. It's caused by that because it starts plugging all the different vessels, and your blood vessel become thickened and start damaged, because remember it start plugging everywhere, so it's become hardened, and the blood pressure go up. And one of the things that even worse is your nerve damage, because nerve damage can be worse because you have problem with plugging the brains everywhere. The nerve is start getting damaged, so you can't feel. So, for example, you can upset your stomach, your whole vagus nerve area. So you can have constipation, stomach problem, all kind of problems can occur. And if your extremity circulation will poor, you can't even feel. End up, you know what? You're gonna cut your amputation. You cut your foot, and 70% of the patient will have diabetic neuropathy. In other words, the kidneys are failing. And also pregnancy, as I mentioned, many of them have gestation diabetic. Eventually, they will also end up with diabetes. So also because they can't feel, so sexual dysfunction, where have no sex feeling. This is sad. 30% of the patients with diabetes had no sex because they can't feel. So you don't want to put yourself into this shoes. You want to make sure, stay away from that. Is you got to prevent yourself getting to serious diabetes. Okay. 嗱，二型糖尿病嘅併發症係好多嘅。第一，你係會有中風嘅風險啦，唔記得嘅風險。呢個係好大問題啊，唔記嘅。因為咧，當你係70歲嘅時候咧，你 keep 問你個仔，阿仔你食咗飯未啊？你係咪17、8次嘅？因為你唔記得個 short term，你問咗佢3分鐘後，你唔記得咗啦。咁好擺，咁個人咧就好，即係好多人都好 frustrated 啦，唔係咁開心啦，因為咁嘅情況下。所以變咗嚟講咧，都希望你個個要注意咧，其實真係要 protect 你自己。眼嘅青光眼啦，同埋你個胰臟常都有壞啦，又出唔到胰島素啦，咁你打胰島素啦，咁就心臟病啦，60% 嘅病人都有心臟病嘅，即係血管嘅塞啊，所以咪有心臟病啦。咁血壓會高啦，同埋啲血管硬化咗啦。咁最弊咧神經系統損壞呢個係好大問題嘅。咁就話做咧神經損壞點解好壞嘅問題咧？因為當你神經損壞嘅時候咧，好多嘢 feel 唔到啊。咁譬如咧，呢個就會 affect 到你胃啊，去大便有結宮啊，呢啲全部即係可以影響到喎。咁你 feel 唔到injure 咗嘅時候，你又唔去處理佢咧，咁咧嚟腳都斬埋佢。咁同埋咧，70%嘅病人咧都有呢個糖尿腎病嘅問題嘅。咁就話如果你懷孕咧，亦都有當然啦，你嗰陣時好翻之後，3、4年後你可能變咗糖尿病。仲有可能冇性功能，我話因為你冇感覺嘛，咁性功能有一個問題嘅。So another thing that a lot of people don't realize, if you are diabetic, you have 7% of your the future child born, potential have birth defects, and the birth defects are usually developed in the area of heart, blood vessel, kidney, urinary tract, gastrointestinal tract, brain, and spine. So you really want to get your future baby to be healthy. Hey, make sure you don't get yourself with diabetes. So make sure that you don't want to get yourself when you're pregnant diabetes, so you can eventually develop some form of birth defects, and that will be nothing is good, right? 咁啊，仲有各位堂友啦，其實如果你係要準備有 BB 嘅 ，make sure 你真係唔好有糖尿病。點解咧？因為原來咧係出生嘅。嘅 birth defect 咧有大概7%，咁多數啲 defect 喺邊度咧？血球喺邊度咧？就多係心啦、心血管啦，或者任何嘅血管啦、腎嘅臟啦、尿道啦、腸胃啦、腦啦，同埋個 spine 即係脊骨後邊啦。所以變咗嚟講咧，呢啲係全部都有呢個問題咧，就希望你真係唔好有呢樣嘢啦。Another problem that type 2 diabetes, a lot of times that they also have mentally health issue. The reason is they have so much stress. And people who have diabetes condition, they have 2 to 3 times more likely to experience depression, anxiety, eating disorder. And so a lot of people call this called diabetic distress. The reason why is because, one, they feel very angry. They say, how come it's not me? They can deny, or is it because of me? They feel very guilty. So a lot of these, they feel very frustrated. They're very angry about what happened to them. So they also worry about the disease, and they also lack of motivation to manage diabetes and avoid doctor appointment. A lot of time, they avoid checking the blood sugar levels. Also feel very lonely. They feel, especially they feel really alone, nobody support them so they don't know how to go forward, so to speak. And I talked to a lot of people who are diabetes that they really felt frustrated because of the fact that, wow, you mean I have a problem. Is it really because of me, become a diabetes, some body issue? And they really worry about it. If they worry about it, the blood sugar continue to go up higher. And the lifestyle is not be good because they say, I can't eat this, I can't eat that. So if you can able to understand your disease, able to control it, because actually I have all kind of food that I can eat, even I'm diabetic, but I just need to get healthy food. For example, snack instead of eating cookies, I eat a celery stick. I still eating, and I still can eat all kind of good stuff in there, but I eating a celery stick versus eating a sweet cookie. That's all. And I can exercise. Well, I can walk. I can run, but you can walk. So you can still achieve the same stuff. Going to walk shopping center for 10,000 steps, with your wife or with your husband, for evening walk. Wow, that's wonderful. Very relaxing. So you can truly enjoy your lifestyle without depression, anxiety. So don't think that, don't get angry, don't get frustrated, and just continue to learn and understand the disease. You will be so much better. 嗱，好多糖尿病病者咧，心靈健康上咧都影響咗，因為佢覺得自己，哇，唔係嘛，我係我自己好，即係覺得自己啲嘢咧，全部都係自己做出嚟嘅。其實唔係，呢個係 natural 嘅，可能啊，亦都對你無關。但係佢好多時咧，因為焦慮啦，會憂鬱啦，咁呢個人咧，即係糖尿病病者大概3倍咁多咧，係會有呢個糖尿病嘅憂鬱症嘅。所以變咗嚟講咧，你要真係唔好要令到自己身心開放先得，就唔好憤怒，亦都唔好頹喪，亦都唔好擔心嘅病。其實咧，糖尿病咧係可以容易處理嘅，如果你去識做嘅話，亦都了解多啲。你就唔好以為哇，呢樣唔食得，嗰樣唔食得，哇好弊啊，我好口痛啦，樣都唔食得，好煩啦。咁其實亦都唔使自己好孤單嘅。其實咧，你係好多嘢食得，亦都可以好多嘢咧係能夠令到你更加 happy 嘅。因為好似 for example， 我行 supermarket 啦，行個鐘頭啦，同你先生話你老公同你或者太太行個鐘頭幾開心啊，去睇下嘢係咪？你行咗1個鐘頭，亦都身體健康。我 snack 唔係我食個西芹 stick，rather 就係食個 cookie， 哇幾好啊！一樣做到，但係好開心。你要轉咗佢咧，令到你開心，能夠心靈健康係好緊要嘅。Now, a lot of people don't realize if I have diabetes, actually the cost in US is actually at $16,752 per year additional cost for diabetic because of medicine, because of treatment, all that for a year. This is average. And it is 2 to 3 times of a typical normal person if they're on disease. So really, at the end of the day, imagine that if you have just 20 years, I don't become a diabetic, you actually save $300,000 cash. Imagine that. Wow, that would be really cool. Because if you can able to per year, and you just 20 years, you have $335,000 worth of cash with you instead of you have spending some medication and so forth. Wow, that's almost half a house, right? So really, at the end of the day, if you can able to not to get your diabetes, so you're gonna eliminate all the $335,000 because you delay your diabetes, right? Occurs in 20 years later. Or you maybe don't even ever become a diabetes, so you save not only costs, you have no more hospital inpatient care, medication, diabetic supply, and then maybe because of the diabetes, you even don't have to work. You lost your job or you're not even productive, right? So all these are very expensive. So that's why I really want to make sure work with you so you don't become a diabetes, or if you're a diabetic, I will convert all the way you down to pre-diabetic stage that you continue to be healthy. So cut down your medical costs. Wow, isn't that wonderful? Okay. 嗱，記住糖尿病咧，原來咧喺美國咧，1年咧你係大約使16,000至17,000咁多嘅美金，即係話33萬美金嘅1年嘅錢喎。咁其實香港咧，其實你都會使好多嘅原因，你依家其實喺政府睇啫，但係其實你都要藥噶嘛。如果你使唔到，政府都要俾錢噶嘛，要睇你醫生噶嘛。咁所以其實嚟講，仲有一樣你仲要受苦喎，要吉針喎。咁點解要做呢樣嘢咧？不如唔好去到糖尿病嘅，咁你就能夠更加令到你唔好入醫院啦，你又唔使食藥啦。你唔使買糖尿病嘅用品好似打針啊啲啦，亦都你唔使去成日睇醫生啦，就要睇醫生都係幾個月1次啦。咁原來亦都未必話因為糖尿病影響生活啊同埋你生產嘅能力嘅。所以變咗嚟講， 唔好去糖尿病嘅地方，就要去糖尿病轉翻前期患病，咁咪更加好。So at the end of the day, well, how do you manage your diabetes then? Well, first of all, you got to eat healthy. You have to have always low carb diet. What are low carb diets? 150 grams of carbs per day. So that's what you're going to have, 150 grams per carb per day. And you got to have regular exercise, which is 150 minutes per week. You have to exercise 10,000 steps. And so net result, you can at least every day or every other day, you walk with your husband or wife, walk down shopping mall. Hey, that would be really good. And at least you continue to walk. And also when you're walking all the time, you know what? When you get older, especially when you get 80 or 90 years old, if you continue to walk, most likely you will do continue to walk until the day you die. I have a lot of friends who doesn't walk. And when they get to 85, 87, because they hardly walk, so they are in cane. And eventually when in a wheelchair, oh, that would be terrible already. The leg starts swelling. Wow, that's no good. So really at the end of the day, keep walking and go look at things, and will help you on the better mood, relaxing. When you relax, your blood sugar will go down. And you got to do weight loss. You cannot help yourself to be a BMI over 30. Imagine if a 10% weight decrease, in other words, I'm 225 pounds, I went down to 200 pounds. You have lose 1% of A1C. In other words, I'm 7, I'll become 6. Isn't that wonderful? And you can actually continue keep that at 6 if your weight is continue lower. And you continue to have to measure your blood monitor every day or every other day. If you use poking finger, actually best measure 4 times a day. In other words, first thing in the morning, 2 hours after breakfast, 2 hours after lunch, after dinner. If you can do one more and before you go to bed, that would be perfect. So basically, if you don't measure blood sugar, you actually don't know where you're at. Because that's a part of diabetes. Diabetes is you got to know what is your blood sugar by the poking your finger to get the blood. Now, certainly you're going to have medication. You have to continue to eat your metformin. If you drink Lowsutea, you know what? You can most likely drop down your metformin intake. A lot of people who have 2,000 milligrams because the blood sugar came down. So the doctor will keep prescribing metformin, become less and less from 2,000, like female has, all the way to 500 milligrams per day. So isn't it great? Less medication. A lot of people like Pat, the husband supposedly use insulin, but that's what? Because drinking Lowsutea, no more insulin. So no more poking himself. Isn't that great? So let's continue to strive yourself to manage better on your type 2 diabetes. It's not that hard, basically. Just has a concept, make sure you just stick to it. OK， 各位堂友，其實管理糖尿病咧唔係好難嘅。第一，食材方面，你一定要開始用一個控制嘅方式，減低你嘅碳水化合物咧係大概150 gram 嘅東西。咁其實咧，你依家上網睇下，我蘋果有幾多啊？大概12 gram 或者20 gram， 睇下你係有幾多嘢啦，麵包有幾多啦，食飯幾多啦，或者你個菜有幾多，魚有幾多，嗰啲全部係可以咧睇，即係煮嘅時候咧，你睇到哇，我係有幾多 carbs 喺裏面，係咪？咁呢個咧係可以全部計得出嚟嘅。第二樣嘢，你一定要 exercise 點啊？即係運動啦，咁啊行1萬步啦，每個禮拜行150分鐘嘅東西啦。咁如果你係行1萬步嘅，每日都行到，哇，好鬼正嘅喎，係咪？咁仲有啦，肥胖啦，如果你肥胖咧，你一定要降低大概10%，每次都有個目標10% 高 decrease， 咁你能夠咧先能夠令到你個 A1C 降低嘅。咁同埋咧，每個糖尿病病者一定要度血，你先知你係幾多。咁每日咧，其實最好就度4次以上啦。第一起身度咗之後，早餐後2個鐘頭度1次啦，晏晝後2個鐘頭啦，晚黑度1次。食完飯最好咧，如果你更加你要想咧，就係臨瞓之前度1次。咁但係如果有冇係咧4次都好 OK 㗎啦。咁一定度咗之後，你就知道你個 trend 寫埋佢啲話，寫低佢啊。咁你就知道咩？如果唔係咧，你就用咗個 app Libby 嗰啲更加好啦。 咁就唯一咗咧要食糖尿藥啦。咁如果你飲咗去糖茶咧，most 你嘅血糖咧都係一個好嘅 level 啦。咁醫生咧就會減你藥嘅。好似阿 Pat 啦個老公，例如腦數唔使打啦，阿飛貓由2000個 milligram 食到500 milligram of metformin， 咁幾好啊！所以其實咧飲去糖茶係即係幫助你咧唔使食咁多藥，亦都幫助繼續去減低血糖。呢個係一個好重要。So let's remind you what is pre-diabetic. Now, diabetic, as you know, you don't get well. If you are pre-diabetic, you have a chance to control and then not going to diabetes. So you gotta control, because imagine diabetes is a lifelong disease and you won't get well. You can only control. Well, how do you control? You have to control basically on dieting, exercise, weight control, and then measure blood sugar. So basically, it's very simple. You have to control your blood sugar, prevent them to become from pre-diabetic to diabetes. You also prevent yourself have all diabetic complications. And the key thing is, if you can control your blood sugar not going up from A1C 5.7 to 6.4 and moving beyond 6.4, you'll be very good. But if not, you don't do your lifestyle change, you know what? You are actually most likely to become a diabetes in 3 years, and that won't be good. So the proper dieting, exercise, weight control is really the key of control your diabetes. And certainly with that, your diet, you're going to have no white food, no juice. It basically has to be controlled. More important, you have to start drinking Lowsutea, because after drinking Lowsutea, you can decrease your blood sugar, cholesterol, blood pressure, and detox, going down your 3 high. So with that, you can be continually healthy and cut down your medical expense. Imagine in 20 years, the medical expense, if you have diabetes, will be as high as $300,000. But you can actually remove that by keeping yourself healthy and enjoy life. How wonderful that is, right? So 各位朋友嗱，記住糖尿病咧係一個慢性嘅疾病，係唔會好嘅，只能夠控制。咁點控制啊？其實控制咧好簡單，其實你只係能夠喺食材方面有運動，同埋咧你係減肥，咁你控制咧一定會控制得成功好嘅。咁但係控制咧就一定要咧令到你唔會變咗，因為如果控制得好咧，你就會變咗一個真係有嚴重嘅糖尿病咯。如果你前期患病，如果你喺3樣亦都轉咗你嘅生活習慣呢啲咧，咁你亦都會變咗咧，唔會變咗一個變咗惡化到一個長期嘅糖尿病者啦。咁咧仲有咧，你係改變咗生活習慣啊嘛，唔好食白粉嘅嘢啊嘛，唔好食麵包嗰啲啊、果汁啊啲啊，咁飲咗咩啊？去糖茶，咁就真係會幫助你全部身體係咁健康嘅。咁希望咧，如果你身體健康，你就減低咗。如果喺美國話咧，已經係30萬嘅醫療費用，同埋你繼續身體健康，你都唔會 suffer。真係開心啦！所以其實好希望各位聽完書之後繼續努力去減你血糖by食材、exercise 同埋減肥。咁你咧一路落去咧，哇，身體健康，可以繼續 enjoy 你個grandchildren 啦，你個孫仔啊，或者可以繼續去遊埠啊，幾開心啊，係咪？所以繼續努力，我希望大家身體健康。So I hope this lecture provide you an overall again, so understand what is diabetes and how bad it can be if you do not actually take care of yourself. So I hope that you can able to have more understanding now. You can also hope that you can able to more control yourself with food. So that's what we want you to do if you can. So I'm here to answer any question. If you have a question to ask, maybe you can help me to answer now. Any question? Okay, if there are no more questions, I will basically thank you very much for listening to this webinar. Hope that you all have a chance to better health instead of spending $300,000 in medicine, because better to be good health instead of spending medicine. So thank you again. I appreciate all your time to listen on your busy weekend. I will see you next week. You take care. Bye-bye.